Very excited to welcome you to today's VETgirl YouTube live event. We are going to be talking about canine chronic enteropathy, and I have to tell you, you are in for a treat. We have Dr. Manchester here with us that has been with us on the VETgirl platform before and at VETgirl U, and we love having her back here today. Welcome, welcome. I should say maybe good morning. It's not good morning for me anymore. I'm on the East Coast. It's 12:01, but I know it's good morning for Justine and Dr. Manchester. I will tell you, I am logging in from fall-like weather, Pennsylvania. Listen, I enjoyed summer, but fall pumpkin spice lattes, we're all excited about them, right? Actually, my favorite, I like the new caramel apple macchiato thing that Starbucks has, but that's where I am. Justine, where are you logging in from today?
I'm excited to be here today. So thank you everyone for joining us. I am from St. Paul, Minnesota on a beautiful 75-degree day. And I apologize, my office is in works right now, but glad you guys could join us for coffee, lunch, or whatever 30-minute break you get during the clinic day.
And Dr. Manchester, what about you? Where are you logging in from today?
Yeah, so hi, great to be here. It's just mid-morning here and I'm in Fort Collins, Colorado, and it's very rare here because we actually have some clouds in the sky. But yeah, also happy because we're getting cooler temperatures, so very welcoming that.
Awesome, awesome. And if you are a VETgirl tried and true member, you know what I'm going to say next. I want to know where you're logging in from. So if you can go ahead and type in, we already have our friend from Portugal here. I told Dr. Manchester Portugal is going to show up right on top of the list as well as many other places. So please go ahead. We love seeing where you are typing in from around the country and around the world. And as you're doing that, I'm going to continue with our housekeeping so we can get to this lecture as soon as possible. First, I wanted to give a huge VETgirl shout out to Purina Pro Plan Veterinary Diets. They are an amazing educational partner with VETgirl, and with their generous support, we're able to put this free, completely free, race-approved session on today with Dr. Manchester. So again, thank you to Purina Pro Plan Veterinary Diets for being here with us today. And as you're typing in, I'm seeing the UK, San Diego, Sweden, Texas, Colombia, Quantico Marine Corps Base. Thank you for your service. Vermont, we love it. Ithaca, California, Nova Scotia. Keep typing in, and we absolutely love that, love that, love that. Now, as I said before, this is a completely free race-approved event. So how are you going to get your CE certificate? There are two ways. One, you can use your fancy phone, that QR code, to fill out that form, or you can type in your browser, and I know Justine just put it in there as well, tinyurl.com/VG, which stands for VETgirl, and then today's date, 9/5/24. We're going to leave this form open till 1 o'clock Eastern. The lecture ends at approximately 12:30, so you will have 30 minutes after the session ends to fill out that form, and then by the end of the day, your CE certificate will end up in your My Credits page. Importantly, please, when you fill out the form, use the email address you use to log into your VETgirl account. That's how we are going to merge that CE certificate with your account. As this is on our YouTube page, many of you do know this, but you can make YouTube the full screen of whatever device you're using. Just click on that bottom right square in your browser, and it will make that YouTube window the entire screen so you can see it as best as you absolutely possibly can. If you're not a VETgirl member, we certainly hope you join. We love our YouTube live events, but we really love what we do. We provide clinically relevant, practical, cutting-edge CE in a multimedia approach. So whether you're watching a YouTube live or one of our more traditional webinars, listening to a podcast, reading a blog, and the list goes on. We certainly hope you're enjoying our certificate programs. Now we have a total of 14 certificate programs. What we do is we really carefully curate content in a specific area to help you become more proficient in something. So whether you're saying, you know what, I need to get really better with anesthesia or ophthalmology or emergency medicine, these are value adds, part of the platform, part of your membership. So please take advantage of all these amazing things. So whether you're an individual or you join as a team member, it's a great cost-effective way to get your CE. Now, Dr. Manchester knows all too well how amazing our conferences are. I am pumped to be in Nashville this June coming up. A little less than a year from now, we are going to be in Music City at the amazing Renaissance Hotel. So here's my plea. I don't want you to have FOMO. So sign up now before the price goes up and before we sell out. We've sold out every single year. We are going to sell out again. In fact, I think we may sell out before 2025 even gets here. So don't have FOMO. Sign up, meet with us, see us, get to be part of our amazing VETgirl U events. We really treat you the way you should be treated and deserve to be treated. So we hope to see you there. With that said, I know you're not here to listen to myself and Justine will be back later with questions. We are here to listen to Dr. Manchester in this amazing presentation. So Dr. Manchester, again, thank you so much for being here. I'm going to drop myself and Justine out. If you can give our audience a little bit of a background about what you love to do, where you practice, and then please take it away. The floor is yours.
Awesome. Thank you so much. Again, really excited to be here today. And honestly, I'm getting to talk about literally my favorite topic. Currently, I'm at Colorado State University, where I both do research and I'm on clinics, both on the internal medicine service and sometimes helping out with our community practice service. And yeah, I really love kind of combining clinical casework and talking with clients with research so we can try to answer some of those frustrating questions. So yeah, we will just jump right into it this morning. And yeah, we're going to be talking about chronic enteropathy. And just so that we're on the same page, we're just going to remember that this is a clinical syndrome that presents in a really diverse number of presentations. And you can see here some of my beloved recent patients I've seen in the last few years. And honestly, they come in with a whole plethora of clinical signs. And I'm hoping today we're going to take a case-based approach to try to optimize manage of these patients. So when we think about chronic enteropathy, you might be a little confused. Why is she saying chronic enteropathy? Why not IBD? And I think kind of a theme again throughout this webinar, we're going to kind of think about what we used to kind of think and sort of replacing that with the kind of updated things that we're trying to get used to. So the reason why I'm not using IBD as much, and I will admit I sometimes slip up and use that term because it is, I think, more recognizable, is that it's likely more complicated than just an excessive number of inflammatory cells in the gut mucosa. Also, we want to distinguish what we see in dogs from what we see in people. Likely when people hear IBD, they might think about things like Crohn's disease or ulcerative colitis, which thank goodness isn't what we see in most dogs and cats. So we are using this term chronic enteropathy, and I like this term because it does really kind of capture the syndromic nature of this disease and allows us to integrate the different types of kind of physiological defects that are likely underlying what's going on in these patients. So we realize it may not just be kind of an overzealous immune response. We probably also have epithelial barrier dysfunction, which is going to influence our ability or our patient's ability to digest and absorb. Probably also in other patients, more of a degree of dysmotility. And that might also involve some increased visceral hypersensitivity. So maybe that gas passing through the intestine is really painful for some dogs. And so in this way, we can think of chronic enteropathy, again, as a syndrome, not a distinct disease entity. Hopefully in the future, we'll find those kind of individual subgroups of patients that we can treat specifically. Not yet. Our workup really is focusing on ruling out specific causes for these clinical signs. So what's really a diagnosis of exclusion. And then remembering that most dogs are not going to require immune suppression. And that's really different from IBD we see in people. So again, like I said, I think I learn best from cases. So I wanted to share a case I've seen recently to try to convey some of these concepts with chronic enteropathy. And we'll use Scout as an example. When I met her, she was a 5-year-old spayed female Labrador retriever. And she had a clinical presentation that probably a lot of you out in general practice see all the time. She had this chronic intermittent kind of large bowel diarrhea that seemed to be getting kind of more to be the rule rather than the exception. During those periods that were happening more and more frequently, she seemed to be uncomfortable in her abdomen, and she wasn't eating like a normal Labrador retriever should be. So where do we start with these cases? And I guess I feel kind of lucky that I like a disease syndrome that doesn't require like a multi-$1,000 workup to start to really make a positive impact. But we do need to get some initial kind of baseline information on these cases. And that's basically to rule out that there isn't something else going on, that I really can focus on the GI tract and that it's not like the liver or an endocrinopathy that's driving things. So I always like to, I'm sure you do the same, kind of explain to owners, why are we doing these different tests? So we're doing a complete blood count to look for anemia, an unexplained leukocytosis, kind of things that might ring a bell for an endocrinopathy, for a weird infection. If they don't have a lymphopenia, I'm going to be thinking about Addison's disease. Chemistry panel really helps us rule out that there's something else in the abdomen driving these clinical signs, which may look like they're coming from the GI tract, but maybe it's liver disease, maybe it's bad uremia. Urinalysis helps us round out that investigation of kidney function. And then I think to start, let's just make sure there's not fecal parasitism, especially for patients that are not on preventatives, which happens really frequently here in Colorado, maybe different wherever you're practicing. But I don't necessarily have any issue with like an empiric course of fenbendazole. After that, we get into more ancillary tests. So should we do some imaging? And I think that's an important conversation to have and to think about in each individual case. What's the utility of that? So for me, x-rays, I would say not super useful if it's like a chronic diarrhea case. However, they're vomiting, if they just seem off, if they're losing a lot of weight, I would say yes. If we have any suspicion, this could be kind of like a chronic partial mechanical obstruction, radiographs could be very useful. Abdominal ultrasound, I think, is done really commonly in these types of cases, but not always the most sort of cost-effective way to spend owners' money. I would say we still do it a lot, especially at the veterinary teaching hospital. However, if we kind of look back and see what is the data to say abdominal ultrasound is helpful, it's really nice to look at this study from Mike Lieb, published about 10 years ago, where they saw kind of retrospectively, how did ultrasound change our plan? And when they looked at 87 dogs with chronic enteropathy signs, they found the ultrasound only markedly altered the diagnosis in 15% of cases. So I think that's just something to, discuss with owners. And for me, I'm going to really be pushing for ultrasound or highly recommending that more expensive diagnostic if I'm palpating a mass effect or suspecting it for some other reason. So going back to Scout, she already had her minimum database at Banfield before she came to CSU, and that was really, really boring. She had a lymphopenia, so I wasn't worried about Addison's disease. And then her owner was really kind of encouraged to pursue the ultrasound just based on Scout's clinical signs. And here we found some kind of interesting but potentially non-specific findings. So her stomach was sort of distended with fluid and shadowing material, even though she'd been fasted for 12 hours. So that wasn't necessarily something very specific or a smoking gun, but it did make me think, okay, maybe this dog has some degree of delayed gastric emptying, and that plays into the diet I might select for her. But essentially at this point, I think I feel confident. No, I don't think. I know I feel confident that she fits into this chronic enteropathy syndrome. And I'm immediately thinking, okay, can I improve her clinical signs and her quality of life with diet? And we know from studies dating back to the early 2000s that diet is the most effective therapy for dogs with chronic enteropathy. And although this may seem sort of like, common knowledge now, it actually was pretty groundbreaking back when Dr. Allensbach published this back in the early 2000s. And people were really kind of shocked and sort of skeptical when she found 66% of her about 200 dogs responded to diet. But we have many studies that have followed that. And I'm sure a lot of your clinical experiences have supported that, the really kind of strong power of diet to improve clinical signs in these dogs. However, it's not always very obvious which diet are we going to use, which kind of strategy are we going to pursue. And so I want to spend the next little bit of this webinar kind of going through the specific dietary strategies we can use and how we might apply those to individual patients. I think, again, kind of comparing older kind of ideas and methodologies compared to what we have today, I think in the past, we used to pursue different strategies, but what I like to do is kind of think about 4 main aspects of how a diet might sort of help or exacerbate disease. And these include looking at things like the macronutrient profile. So how much of the calories are coming from fat, protein, and carbohydrate. I'm also going to be really interested in the ingredient list. So I know our nutritionists would say dogs need nutrients, not ingredients. However, certain ingredients can exacerbate disease in individual dogs, and that could be a reason why a diet is helping or hurting. We also can look at the format of the diet. So is it canned diet? Is it a kibble? Because that big moisture content difference could really influence disease in different animals. And then also, if we could get to the next slide, that would be helpful. We also are, I think, becoming increasingly kind of aware of the impact of fiber and fiber content on dogs and cats' gastrointestinal signs. So these are kind of the things I'm holding in my head, and stats I sort of kind of keep in mind about individual diets that I'm thinking about prescribing to an individual patient. So, like I said before, in the past, I think we used to focus really on kind of two main dietary strategies, and that would be hydrolyzed protein diets and novel protein diets. And that's what we tended to really reach for. And that's what we would see the kind of more older studies look at in terms of diet response in chronic enteropathy. And I'm not saying that I never use hydrolyzed or novel protein diets. I certainly use these diets all the time. And they really do help a good proportion of patients. However, we do have other strategies that can help as well. And I wanted to delve into those a little bit to kind of look at the specifics of when I might reach for individual diets. And that would go beyond just kind of changing the protein source, which we would think would alter kind of the immunological response to the diet. So when we look at newer dietary strategies for chronic enteropathy dogs, we are thinking about, well, can I improve clinical signs by really restricting the fat content? Is a higher total dietary fiber going to help certain dogs? We can use a home prepared diet, which, has its own challenges, but can really help individual patients. And now we do have a new first of its kind amino acid based diet from Purina. So going into kind of the specifics of when I'm going to reach for these specific diets, I wanted to give you sort of clinical clues that make me kind of more anxious to start off at least with that dietary strategy. So when we think about fat restricted diets, and we have a number of fat restricted diets out on the market, including new hydrolyzed protein low fat diets from certain brands, I'm going to look to reduce the fat content of the diet. Firstly, if I hear kind of clinical signs that make me think this dog could be suffering from gastroesophageal reflux, and that's not always kind of the obvious like regurging or, having like a rumbly tummy after a meal. I also would think about that in that dog that's like doing excessive hard swallowing, dogs that are having poor appetite, especially in the morning, kind of those types of things. If I have lymphangiectasia as a possibility on my list, and that would come from hints like findings you might find on ultrasound, like hyperechoic speckling or striations in the intestinal mucosa. If we have a breed, if it's a Yorkshire Terrier, I'm going to think they have some degree of lymphangiectasia until proven otherwise. And then also, if you start to get concerned that the dog has a protein-losing enteropathy with low albumin and or cholesterol, I'm going to really be adamant about lowering the fat content of their diet. Also, dogs that are giving you kind of vibes of chronic pancreatitis, intermittent vomiting, abdominal pain, fat content restriction might really help you. And then also, kind of like I started to get suspicious with Scout, you have suspicion of delayed gastric emptying, which could be showing up in their appetite, showing up in vomiting food hours after their meal. Those are all going to motivate me to reduce the fat content in their diet. There's not really a ton of downsides to a lower fat diet for dogs. I guess the one thing would be, say you have that dog that's really underweight and potentially a picky eater, it might be hard for them to gain weight if we're feeding ultra low fat diet. One point I wanted to make here that I think can get us, can kind of cause communication issues with owners is that we really do need to look at the product guide, or at least convert this guaranteed analysis numbers into kind of grams per 100 kcal. And you can see here too, this is actually a product guide and guaranteed analysis from Purina EN Low Fat. So this is already a very, very fat restricted diet. But I definitely have times when owners come in and they're like, well, look at the bag. Like it's only, 12% fat, it's low fat. However, that's a canned diet and it's, 70% moisture, that could actually end up being a really high fat diet. So product guides are just something I try to keep kind of in a folder in my computer so I can easily kind of look up at them and look, okay, 1.74 grams per 100 kcal, that's extremely low fat. Looking next into fiber, that is also another thing we can modulate in the diet, and that can really improve clinical signs. Times when I'm looking to increase the fiber content of the diet would be those dogs showing signs of chronic colitis, which Scout was one of them. We know that fiber can kind of modulate motility in the gut. So if you feel like just everything is going through too rapidly, then you might want to try a higher fiber diet or adding fiber to their current diet. Fiber is one of those cool things that sort of is like a double-edged sword, where it can both add bulk to the stool, but at the same time, it also can kind of be in the colon and draw water into the colon, and that can help patients that are constipated, that have really firm, dry stools. I like adding in fiber also when you have, especially like a lab, golden retriever that are just chow hounds and just always seem to be starving. The higher fiber diets may help them feel more satiated. Fiber is also neat because, and I would think this is due to potentially its prebiotic properties, but we know those patients that just seem to kind of need antibiotics and we can't get them off of their tylosin or metronidazole. There have been many cases where I feel like I can almost replace the antibiotic with fiber, and that helps just kind of like normalize things in their gut and minimize their clinical signs. And that also comes into play when we're thinking about those chronic Giardia dogs. We have some cool research actually in a hamster model where they found that eating a high fiber diet kind of helped that mucus barrier and prevented that Giardia from insisting on the gut wall. So that could be something that you might try if you have those dogs that are just constant Giardia shedders. High fiber is not without its downsides, as I'm sure all of us from personal experience might know. Sometimes fiber doesn't agree with all of us, but the main things I would think about would be, I wouldn't necessarily be reaching for high fiber in like a really emaciated dog. It's going to reduce digestibility and it might kind of thwart our efforts to have them gain weight. And then again, we know that higher fiber is going to delay gastric emptying, so that might not be great for all patients. Home prepared diets, I would say, are probably like the most kind of specific and niche kind of category of diets that I think about. And I think it needs to really be not something we do kind of flippantly, but needs to be a real dedicated attention we pay to this. But there are certain cases where I'm just so glad we have that options. Times when I'm really reaching for a home prepared diet would be in those challenging cases where you kind of have, multiple competing disease processes that almost go against each other. I'm thinking about a beagle I take care of who has both protein losing enteropathy and protein losing nephropathy. And so here I want a diet that's really low in fat and really low in protein. And that's not really something I can achieve with a commercial diet. So home prepared was really helpful for him. I think also when you have those really picky eaters, sometimes home prepared is more palatable. I would say that's not the case for my cat, as she would rather eat kibble all day, but certain patients, yes. Also, like we kind of talked about before, you can kind of go outside the bounds of the normal dietary makeup. So if you need, for whatever reason, severe fat restriction, for example, maybe for a diet with like horrible lymphangiectasia, home prepared might be your friend, at least for a period of time. And then I think a big thing would be if the owner is just like hell bent on cooking for their dog. And I'm not going to argue with them if they can put in the time and do it safely and really follow those recipes to the T. I want to support them in that. Downsides, of course, it's going to take time, just like cooking for ourselves, and it's not for every owner. And then, of course, we really need to be on the lookout for them kind of getting a recipe from a veterinary nutritionist or from balanceit.com, because when we get those sort of recipes that you can find online, high potential for an unbalanced diet. And for this reason, I really, never say never, but I really never do diets for growing puppies or lactating females. Finally, kind of the newest thing we have out there at this point in terms of diets for these types of dogs would be our amino acid-based diet. And that was just recently developed by Purina. So that would be Purina EL. And times when I'm going to reach for this diet would be in those dogs that just seem to have trouble with any type of diet you try to feed them. And that could be because they actually have a true food allergy. Not necessarily the majority of cases we're going to see, especially in my GI realm. However, we do see them, and the amino acid based diet could be really helpful for them. Interestingly enough, Purina EL is really, really low in fiber, and we know not all patients tolerate fiber. So if you feel like that patient doesn't do on fiber, EL might be a good option for them. And again, I like to also keep EL in my back pocket sort of as a strategy if we're really feeling like we're striking out with diet. Could this really different diet be helpful for them? Downsides of an amino acid based diet, I would see this particular diet we have right now has caused firm and dry stools in maybe a third of the dogs that I've fed it to. And while you would think, if an animal came in with chronic diarrhea, what's wrong with a little bit of a firmer stool? But owners were not happy with that. And then also, we just don't have data on long-term feeding. So to me, I typically think of this as more of a short-term, get them into remission, and then see, can they be transitioned onto something a little bit more normal? I feel like I can speak with a good deal of confidence on this diet because I was lucky enough to be able to be one of the head investigators in a prospective clinical trial of chronic client-owned chronic enteropathy dogs at Colorado State that I did back in 2021. And out of the 23 dogs we enrolled that had kind of a range of clinical signs and disease severities, we found the palatability was really good. And that was pleasant surprise because 96% of the dogs ate EL really enthusiastically. And after an 8-week feeding period, we were able to find that 16 out of the 23, or 70% of the dogs, had clinical remission just with EL as a sole therapy. So to me, this was really encouraging that we have yet another dietary option for these patients. And I would encourage you to look at our publication in DACVIM if you want to look at more details about our study. Of course, we need to keep in some other practical factors as well. So I can't stress enough the importance of listening and hearing from the owner what their kind of values and preconceived notions about food. Owners have strong opinions about these types of things. I know I have strong opinions too, so that's fine. But we really need to kind of be on board with the owner. If they're just saying, nope, I'm not going to do that, we're not going to argue, and we're going to try to find a diet that's going to work for everyone. I think affordability comes up a lot because these veterinary therapeutic diets aren't necessarily cheap. However, I would kind of stress to the owners, can we make it work with the budget? And just remind them, if we could get remission with a diet, just imagine all of the kind of ER visits, referring to a specialist, more intense workup that we might avoid if we can get their disease under control with diet. So that's a way that I think is helpful to kind of give them sort of a value benefit for the expense that comes along with some of these therapeutic diets. Finally, of course, we need the diet to be palatable. So especially in your patients that are really picky eaters, we need to make sure the dog is eating the diet. If they're kind of just picking at the food or leaving food behind all the time, that's usually going to be a time where I'm saying, okay, let's do plan B, plan C, because the diet's not going to be effective if the dog's not eating it. So going back to Scout, her owner and I had an open conversation about what she would be up for. And honestly, she was super easy. She was happy to do whatever I recommended. But basically kind of putting together Scout's clinical signs with her intermittent large bowel diarrhea, poor appetite, I wanted to start off with a fish base. So that was a novel protein for her, fat restricted, higher fiber diet. So kind of changing a number of things at once and kind of let's see how Scout does, and reminding her that we really do need to be quite strict in that first 10 to 14 days. That'll really allow us to know, is this diet helping or hurting, and kind of cut out some of the noise we're going to get from other factors. So here I wanted to just be very transparent and show what actually happened with Scout and admit that it's not always like a really quick, oh, first diet works, we never see the dog again. I was actually pleased that diet 1 is that fish-based diet I was talking about. And Scout actually did really well from when I first met her until about 8 or 9 months later. She just had 1 or 2 episodes during that time, but overall seemed quite well. However, I think it was about March of this year, owner just felt like her signs were coming back. Interestingly, it was more like poor appetite and vomiting in the morning. And we couldn't really get that under control with kind of altering her feeding schedule. So I said, okay, let's try something different. We changed the brand, which I do like to try to do just because, different dietary strategies, different companies can have different ingredient sources, which might influence the dog's response. So we changed to a pretty low fat, hydrolyzed protein diet. And I was hopeful. She ate it really well the first few days, but then I get this email from the client, which you can see, which we're always, sad to get those bad news updates emails. But, she says kind of things are going back to how they were before. So I said, okay, let's go back to the drawing board and see what we can do next. And here again, I thought, well, let's change the brand again. We're going to stay in that kind of lower fat category. This diet, I actually didn't have total dietary fiber content because it wasn't included in that company's product guide. However, so far, so good. This was about 3 months ago, and Scout has been really seeming to do quite well. So I'm really happy with that. Difficult to say exactly what's behind this, but I'm actually going to see Scout tomorrow on clinics and kind of confirm that things are going well. So I think the takeaway from Scout and this case would be to kind of keep an open mind. Don't give up after the first diet if that doesn't necessarily work out. However, I do like to remind people to get away from our kind of derm thinking. For GI, we can be a little kind of less patient, and things are not better even a little bit, or they're at all worse after 10 to 14 days of exclusive feeding. We know that diet's not the answer. We're going to move on. And I would say if you have those patients that are a little more complicated, you feel like you're seeing them back frequently, I would recommend, can you make an Excel sheet, keep a log of the different diet you tried, maybe the fat content, fiber content, main ingredients, and kind of say, okay, appetite better, but stool's worse, or, with higher fiber, stopped vomiting, but seems to have more gas, things like that. I think can help you kind of be in touch with the owner and really feel like you're making progress as you go through these different trials, and keep the owner on board with you so they don't get sort of disillusioned with this idea. Moving on, I do think it's important to kind of have a little reality check and say, well, when do we just kind of give up? Because we can't just keep trying diets for months and months on end. And I think it's kind of interesting to think about. In the past, it used to be, they fail a hydrolyzed protein diet or a novel protein diet and can't be diet responsive. And we start giving them antibiotics or immunosuppressants. However, I think things have really changed with that, because we realize that there's not like a be all end all diet for all chronic enteropathy dogs. And if we look at kind of recent publications and experiences of internists, nutritionists, practitioners, we realize that we can see a lot more dogs that end up being diet responsive when we try more diet trials. And so I would definitely encourage those of you on practice to take that strategy. Let's look at an example, though, of where maybe we aren't having as much success with diet. And we can look at one of my favorite cases, and this was Holstein. When I met him, he was a 2-year-old neutered male Great Dane. Maybe not so great because he really struggled with horrible GI signs. You can see, I don't know how great those images are, but he's rail thin. He's muscle wasted. He is going on and off with good and bad appetite and struggling with diarrhea, very low B12, but otherwise looks pretty normal biochemically. So Holstein actually was a joint patient of internal medicine and nutrition. And we tried, I would say, 5 different diets. Ultimately, he was eating like 9 cups a day, half of hydrolyzed, half of high fiber, to try to get his stools better. But we reached a point where, I don't think it's cutting it with diet. So what do we do in those cases? I think it's always important to try to take a step back and say, okay, am I missing something? Can we make any sense of why these episodes are happening? Or is it just constant clinical signs? Do we have extra GI clinical signs that make us think we need to get that abdominal ultrasound, test for infectious diseases? Have they lived in the South in Texas. We don't have as much here in Colorado, but, I'm going to be thinking of things like heterobilharzia, prototheca, if they've been traveling to different areas. And also it can be helpful, has anything we've tried helped? Because sometimes that can be the most important information. And in some cases, we do need to pursue those further workup because we might be missing something. So do we need an ACTH SIM to rule out Addison's? Do we need to get intestinal biopsies? And I think, we don't always know exactly which patients need to be referred to get those intestinal biopsies. However, the red flags to me would be, are they losing weight that's really not explained by the severity of their disease, or, we can't keep them nutritionally adequate? Other good thing about sending them for referral for intestinal biopsies would be a time to place an esophageal feeding tube. So at least we can support them nutritionally during the process. And then also, if they're just not getting better despite logical treatment trials like normal deworming, good veterinary therapeutic diets, that's when I do really think we need to have that conversation with the owner and see if they'll allow us to scope their dog. So for Holstein, we actually, I was able to enroll him in a clinical trial of mine and scope him for free, which was wonderful. And here, we kind of had some interesting findings. I wasn't necessarily expecting the severe neutrophilic and eosinophilic enteritis. However, we didn't see any kind of smoking guns in terms of infectious agents, no sign of cancer. So obviously, we already knew he had severe disease. This didn't necessarily tell us anything specific, but at least made me feel a little bit better that I wasn't missing something like cancer or like a fungal infection. So with this finding, all those neutrophils, we'll get to his treatment in a minute, but honestly, we need to think about what are our options when diet is not cutting it. And I would say, certainly we can use immune suppressants. Personally, I have a pretty low tolerance for the side effects that come with immune suppressants like pred or like cyclosporin. So I would always advocate for trying to improve clinical signs with the lowest doses and fewest drugs possible. And I personally feel like I have a good amount of success with budesonide at low doses. Antibiotics are definitely a controversial thing in the chronic enteropathy field. And I think sometimes you'll hear from researchers and specialists that say, never use antibiotics. I would admit I'm not necessarily in that camp because I think we do have a proportion of patients. I think a lot of like German Shepherds that just cannot have a quality of life without antibiotics. So they're not ideal. They should not be used first line. However, some patients seem to need them. For probiotics, I would say, I think there's a lot of kind of theory around why probiotics could and should help. However, the clinical trials haven't necessarily shown a great clinical impact for them. But I would just say, I think in individual dogs, they can be helpful, but I wouldn't necessarily think of them as like a first line of treatment. So going back to Holstein, when I got that biopsy report back and just knowing we'd really kind of struck out on diet. And I really didn't want to put him on high doses of pred since he's such a large breed dog, probably going to have horrible side effects. So I actually tried antibiotics. And kind of shockingly, he had a really amazing response. He was able to gain almost 14 kilograms, and he turned into a dog that could just eat whatever he wanted, and his stools were fine. So don't exactly know. He's probably an outlier. However, I just wanted to present him as a case that we don't always achieve success with diet, and there are other options out there. So kind of with that, I know that was a whirlwind, but hopefully you were able to get some things that would help with clinical practice. But I think the take home for me would be communication is really important. These are cases that take time. It's not something we can always like jam into a 15-minute appointment. So any way we can kind of buy more time, enlist the help of our technical staff, and really get a sense for what's happening with the dog, what the owner's on board with, and what they should expect with diet. I think that's going to really improve our clinical success. I would remind myself, as well as all of us, to keep an open mind and realize that it's not always just like one diet we think is going to be the best. They might get, sort of clinical help from different dietary strategies, and it's good to keep those in mind. And then also, I just wanted to give us all some sort of optimism. And if at first we don't succeed with diet, there definitely is still a chance that we can find a diet that's going to help that dog. And we don't need to feed it for weeks and weeks and weeks on end. If they're not better after 10 to 14 days, let's go on to plan B and plan C. So with that, I appreciate everyone taking time out of their busy day, and I'm really happy to take any questions that people have.
Dr. Manchester, that was amazing. Thank you so much. It's such a common thing that we see. Again, I don't do GP, and I see this all the time in the ER. So many great points. And I always joke, whenever I used to be on, the practice manager inventory person would be like, "Oh, Justine's on. I better order a ton of this high fiber food." Because to me, it's like treat all things colitis, right? So you brought up some amazing points. We do have a bunch of questions that I just wanted to ask. Are there pros and cons of using a fiber supplement versus a high fiber food?
Yeah, I think that's a great question. I didn't really get into that, but I would admit I do both realms. So I think if the owner is like overall happy with how the diet they're eating, or maybe they're really like, wedded to a certain diet, maybe all the dogs in the house are on that diet, let's just try adding in the fiber, see how much benefit we can get from it. Maybe that might be more cost effective for certain patients as well. I would say maybe if not all dogs if you mix in this powder with their food, and maybe the powder just ends up in the dog bowl and the dog's not eating it. So in those cases, maybe that's a time where I'm going to try to go for that veterinary therapeutic diet that's high fiber.
Great. Thank you so much. Now, another question, and I should say before we get to all the questions, please, next time you guys see your Purina person, please make sure to take the time to thank them for sponsoring this amazing event. We couldn't do it without the support of our sponsors. So a huge shout out to Purina Pro Plan Veterinary Diets. And again, Dr. Manchester was an amazing speaker at VETgirl U, which was just a couple of months ago. So we're really, really honored to have her do this YouTube live again. So Alison, thank you so much. So that said, let's jump into a couple more questions. I see another question about fiber. What's a sign that we should be looking for if the pet owner is adding too much psyllium or fiber to the diet? Would we be able to identify anything besides the constipation or potentially chronic weight loss, which we want to catch before then?
Yeah, that's a great question too. And I would say my general strategy with fiber is to start low and gradually ramp up. And usually I'm maxing out at for a giant breed dog, 2 tablespoons per meal. That to me is a pretty big dose, but you'll see it. I think if you use fiber enough, you'll start to see if maybe it's too much for that individual dog. They can get this slimy coating on their stool. They can get bloated, gassy. I've also had dogs just having 3, 4, 5 bowel movements a day, and owners, especially if a big dog, owners don't always like that. That's a lot of cleaning up in the yard, or a lot of bags are going through. So those are the things I would look for.
Especially for dog size Holstein.
Yeah.
One question about sucralfate. I don't know if we have sucralfate oral gel in the United States. So this is a question from Portugal, but is there any experience with using sucralfate to aid in the enteropathy?
Yeah, good question. And I think sucralfate is a cool drug. And if you look at its mechanism of action, you'd think it really might help cases, especially if they have signs of gastroesophageal reflux or those kind of upper GI signs. Here in the US, we only have the tablet, which we just dissolve to make a slurry. I would say I use it fairly specifically. It wouldn't be like a common blanket treatment I'd give to a dog with chronic enteropathy, and maybe more think, if they've had a period of a lot of vomiting, to kind of help with healing that upper GI gut mucosa. But I'm usually thinking of it as a short-term drug, not something I'm going to prescribe for months and months.
Yeah, great. And in full disclosure, I'm actually on sucralfate or Carafate right now for a stupid ulcer from stress, but that's unrelated.
Oh, no.
And I will say, I actually, once I was diagnosed with it, I don't slurry it because it tastes terrible.
Yeah.
But I do use the 100 mg per mil liquid. But I always say, I feel like H2 blocker sucralfate are often overused. So unless it's really, really upper, I would say, sometimes it's just harder. You have to justify, is the pill worth giving when the owner's having difficulty giving it? So you just have to keep that in mind too.
Yeah, totally agree. Because some animals, it just we see it in our CCU all the time. You see it's all over the cage.
Mm-hmm.
The animal's upset. The tech is upset. Everyone's upset. So it's it's not working for this patient.
Yeah. I've had a pet owner come in. She had 12 medications for her Lyme nephropathy. She's like, I can't get this pill in. I was like, screw the sucralfate, get the doxy in.
Yeah.
So, all right. Great question about, do we include B vites I'm assuming cobalamin and folate with our basic blood profile for like any chronic enteropathy?
Yeah, that's a good question. I didn't talk about that in my kind of like initial workup, and I would say I typically don't, send off that blood right away. Probably a lot of that is for cost reasons, and it's not a test we have here in our clinics. We have to send it out of state. I don't think it's wrong. Another thing I would say is that, if you have like a cost constrained owner or an animal you see is quite ill, you think like a low B12 could be present, it's not wrong to empirically supplement. It's just a water soluble vitamin. So if you give it and they actually didn't need it, it should be fine. So I would totally admit that I do empiric supplementation sometime, but it can be nice to send it off if you have the resources and you can get that blood from the dog.
Wonderful. Thank you so much. I do see a couple questions in terms of one great comment from Jose. Diet failure is not always a diet failure. Sometimes it's the owners giving something that they shouldn't give. So again, great point. One question on the use of, I know you briefly talked about probiotics, but what about products that are specifically anti-diarrheal that have pectin in them?
Yeah, I kind of think of those a little bit under like the fiber category, and I definitely reach for fiber. If a dog is having sort of a flare, maybe they were coasting along, doing pretty well, like happens with Scout sometimes, and just, fell off the wagon for whatever reason, ate something they shouldn't have, got stressed, who knows. But I do reach for those types of products for kind of short periods of time. I don't necessarily see them typically as like a chronic like cure type treatment, but I personally think they can help sort of get dogs through those rough patches. And I'd much rather use those types of things than something like a metronidazole or a tylosin.
Wonderful. All right. If you have any other questions, feel free to type them in. Otherwise, amazing talk. I especially love the takeaway of being able to use high fiber with chronic giardia, which of course my dog has. And I will say it definitely helps. So absolutely love the topic because again, we see this all the time, whether or not you're in specialty, general practice, and emergency. It's a disease that covers all locations and all professions. Again, huge shout out to Dr. Manchester. That was amazing. Love the lunchtime 30-minute talk. And again, a huge shout out to Purina Pro Plan for sponsoring today's talk. And we hope to see you guys on the next VETgirl webinar. And thank you again for all that you guys do. I know you guys are busy, probably like shoveling food in your mouth as you're standing up, watching, getting CE while you're also treating something in the back. So thank you guys so much for all that you do too. And just wanted to thank you again. That was an amazing lecture. Thank you, everyone.
Yeah.